Hello and welcome to Health Matters on Channels Television. I am Yomi Otaibi. With the announcement of 329 new COVID-19 infections by the Nigeria Center for Disease Control on August the 14th, the country's total confirmed coronavirus cases now stand at 48,445, moving steadily towards the 50,000 mark. With 35,998 discharged cases and 973 COVID-19 related deaths, Nigeria currently has 11,474 active cases. If we go by the NCDC target of testing 2 million people for coronavirus in 3 months since the end of April 2020, the country is clearly lagging behind in sample collection and testing, with just over 300,000 samples tested so far. A few private COVID-19 laboratories and treatment centers have been enlisted by the Lagos State government, the state that is the epicenter in Nigeria. And one of such is the Zainelab PCR laboratory and armoured shield medical center under the Reddington Hospital Group. The privately owned facilities were officially launched in Lagos this week. Take a look.
The Zainelab PCR laboratory and armoured shield medical center stand as Reddington Hospital's group's way of supporting the Lagos State government's effort at ramping up testing and providing alternative isolation and treatment centers for COVID-19. The new centers offer PCR testing for coronavirus disease, 50-bed private isolation wards, computer tomography or CT scan, high dependency and level 3 intensive care unit for the management of all levels of coronavirus infection.
The Reddington Hospital established the armoured shield facilities in different locations in Lagos, away from all our facilities and branches, to give comfort to all our patients that they can now safely access care in these facilities without the fear of COVID.
On hand to officially launch these medical services is a Lagos State Commissioner for Health, Professor Akin Abayomi, members of the Reddington Hospital Group, and other well-wishers.
This place keys into our strategy very nicely. It's 100% accredited. Every test that's done here, we're really confident about their results, and we keep coming back to check. So it's not just a one-off thing.
The primary thing that makes Armoured Shield different is that as a healthcare group, we not only do treatment, but we also test for the virus. So essentially we have end-to-end treatment plan.
The state-of-the-art equipment at Zainelab and Armoured Shield Medical Center are manned by a multidisciplinary panel of specialists.
We have high dependency rooms as well as ICU units. So for the ICU unit, which is a level 3, we have things like the ventilators, of course, your bypass, your BiPAP. You also have your gas analysis machine. So one of the things we have, which is a unique feature from all other isolation centers, is the HEPA filters that we have. Now this is just the exchange of air. This way, the people who are taking care of the sick would actually not get sick too.
We have a team of doctors that have been trained in critical care response. We have also nurses that are trained in critical care. We've got midwives in our group because we have a theater here and we have a delivery suite. Knowing what COVID is, we place the highest premium on infection prevention control.
The Armoured Shield Medical Center also has a COVID-19 command center with 24 hours telemedicine and emergency ambulance response.
To tell us more about COVID-19 case management at the Armoured Shield Medical Center is the medical director of the center, Dr. Olushola Oluwole. Dr. Oluwole joins us from the Victoria Island area of Lagos State. Thank you so much for being with us on the show.
Thank you very much for having me.
Okay, so let me start by asking, what confidence and expertise is Armoured Shield and, of course, Zainelab, bringing into sample testing and COVID-19 treatment in Nigeria?
Okay, to start with, as it might have been seen on that clip, the Armoured Shield Medical Center, or the Reddington group as a whole, brings in the perspective of not just treating patients who are infected with the virus, but even assessing those who are symptomatic or asymptomatic, as it may be. So in other words, we have Zainelab, which is a testing center where we collect samples and we test for the COVID virus. And when an individual is tests positive, then we have the option, or rather we have the extra channel whereby we can actually channel that person into our treatment center. And our treatment plans break up into 4. If someone who is symptomatic, rather asymptomatic or very mildly symptomatic, can be isolated at home. Those who perhaps have a little sicker, or an older patient, or people with comorbidities would then be sent to our isolation center. If they present with even greater symptoms, for example, shortness of breath, inability to breathe, oxygen dependency, then we'd send them to the high dependency unit. If the case gets worse than that, where they need to be on a ventilator, then we have the ICU care.
Okay, so, but I'm not sure if you've heard of this. Some people, have the belief that these kind of virulent and contagious infections are better managed at public or government-owned facilities. How would you allay the fears of those who have these concerns? Talking about a private concern or private health facility, managing COVID-19, particularly at Armoured Shield.
Well, for one, as a private institution, as a private medical institution, we adhere to the highest standards of care, international standards of care, actually. Secondly, the Lagos State government would not accredit us if they didn't feel that we were up to the task of both testing and treating patients with COVID-19. Then thirdly, we provide support system to the Lagos State government, as do other medical centers. And in part of that, we have a telemedicine platform so that even those who are at home, for example, who are isolated at home, we have the ability to monitor them from our remote location. We provide them with certain tools to gauge how well they're doing. And if they deteriorate, then we can escalate and bring them into the isolation center. So as part of our network, we also have ambulances that can fetch patients. And of course, we also have a multi-specialty team consisting of intensive care specialists, pulmonologists, cardiologists, people trained in endocrine and renal specialists as well.
Let's talk about the turnaround time for COVID-19 samples. If Zainelab is working on it, what's the turnaround time? Because we've heard some people will have to wait for 1 week, 2 weeks before the results will come out. Okay, I Dr. Oluwole Olushola there. I'm hoping that he can connect back with us. But we'll come back to the studio. I'm now being joined by a public health physician who is also the secretary of Nigerian Medical Association, Lagos State Chapter, Dr. Ime Okon. Thank you so much for being with us.
Thank you, Ami.
Okay, let's start from, what we're just talking about. What's your take on, private facilities coming into COVID-19 management and sample testing?
Okay, so in this COVID-19 outbreak, we've enjoyed a lot of private sector participation. Like I always said, COVID has shown that it's a classless disease. It affects everyone. And I was really impressed at the rate at which the private sector joined and collaborated with the public sector in addressing this pandemic. They've come in the areas. Private sector entered with donation of funds. They helped with building of isolation centers, the COVID, And now we have a lot of more of them coming on board as per case management. Initially, it was just like maybe one private hospital that was involved in case management, but now we have more cases. Sure, we need them.
Okay. I think Dr. Oluwole is back with us. Hello, doctor.
Yes, sorry about that.
Okay, so you were talking about the turnaround time for COVID-19 testing at Zainelab.
Yes, the turnaround time is 24 to 48 hours. Typically, we aim to have the results out within 24 hours. There's certain logistics that involve making sure that the state government is first aware of our testing, but that doesn't take away too long a time for us to report our cases. So we look to report back within 24 hours.
You mentioned earlier about the telemedicine. Can you quickly tell us a bit more about it, you know, for those who are isolating at home?
Okay. The telemedicine part, we can divide into two parts. So let's take an example of someone who becomes slightly sick and is concerned about their status, and they come to us and we do a test and they're positive, but they're not very symptomatic, perhaps an itchy throat, or perhaps they're not symptomatic at all. Then we would ask them to go home and isolate at home. We would provide them with what's called a pulse oximeter, which measures the level of oxygen in their blood. We provide them with a thermometer that they can use to check their temperature. And we would check with them 3 to 4 times a day, either by video communication or audio communication, whichever is more convenient for the patient. We also ask them to keep the pulse ox on and report back to us on how well they're oxygenating. So that's one part of it. And part of that is that over a course of time, we can check with them. And if we, for example, see that their oxygen level in their blood is diminishing or they're beginning to be a little bit more symptomatic, then we'd send an ambulance to fetch them and bring them into our isolation center. Now, the other part of the telemedicine is that when a patient comes into us, or rather when someone calls in, we actually they don't need to come into the facility. So all the communication is carried out through our telemedicine platform. In other words, we engage them, we ask them questions about their symptoms to determine where they are in terms of their symptomatology. And then from there, we determine what's the best treatment option for them.
Dr. Olushola Oluwole, the Medical Director of Armoured Shield Medical Center in Lagos. Thank you for your time, and we wish you all the best.
Thank you very much.
So we'll take a quick break, and when we come back, it'll be time for you to join in the conversation by reaching out to us on our phone numbers, that is 0805-468-3514, or via Twitter at yomi_Otaigbe. Just stay with us. Welcome back. So, as I said before, I went on that break. You can join us in this discussion by calling this particular number, 0808-054-2233. That is 0808-054-2233. Doctor, now let's talk about, it's almost 6 months of COVID-19 in Nigeria. And, let's look at the journey so far in terms of our preparedness for public health emergencies like this. You remember when Ebola, came and we defeated it, and now we have COVID-19. How do you think we have fared so far?
We've not done badly. Actually, one would have thought that after the Ebola experience, we'll have a much more strengthened health system to manage emergencies. We've actually tried, but of course there's always room for improvements, because even in developed climes, you see that this COVID-19 pandemic was quite a challenge, even where you have very strong health systems. I would say we fared fairly well.
But in terms of our preparedness, we started very slowly. And now from about 3 molecular labs, we have about 63 now or thereabout. So that means we've moved forward in that area. Let's talk about the campaigns, the enlightenment campaign, because if you look at the level of adherence to safety protocols, you want to think that perhaps the campaign is not getting to the right people.
Well, we're trying our best when it comes to campaigns. The risk communication pillar is doing a whole lot in that area. It's just that adherence is not at par with the level of campaigns that we're doing. Like I said, we reach out to community leaders, the gatekeepers of the community, all those influencers, the religious leaders and all that. So, but you know, behavioral change communication is a challenge. You know, when people are used to doing things in a particular way, getting them to change, it's actually very difficult. But
this has taken us almost 6 months now, and if we, of what we know of the virus, it shouldn't be something that, you know, will make people want to say, okay, so I don't want to come in contact with this virus, let me follow the guidelines.
It's about taking personal responsibility, and you know you have to individualize it. Some people that have had personal affectations, maybe someone close to you has had the disease or something, you find out that most of those people take these precautionary measures very seriously. But for some people that have not had a close shave, you know, so they still are quite reckless. I've been to markets and I look very odd using the face mask and all that. So you keep wondering.
Because of, you know, the number of people without the face mask.
Exactly. There's so many of them going about without face mask. And now that relaxation of lockdown has taken place, people are like relaxed, resting on their oars, thinking that it's all over. Yet it is not. It's just that, should I say, we've been saved by grace, but we need to be very careful, and these precautionary measures should not be thrown away just too soon.
And to think that it's about washing your hands, it's about wearing a face mask, even though some people have said, you know, it can be discomforting, you know, wearing a face mask. Is there a way we can go around it? Perhaps if you are indoors, you don't, of course, you don't have to wear the face mask.
Sure, there are ways about it. If you're alone in your car, you remove the face mask, but when you have to enter banks or places like that where you have crowds, you just have to manage and put it on. I dare say the cloth mask, some of them, the materials they are made of, could be quite uncomfortable. But now that we're having locally produced masks, they're coming a bit cheaper and they are more available, not like a time that even when you have your money to buy the mask, they're not readily available because most of it were imported. We relied solely on importation. So now I think people can afford these masks that are breathable, you know, and less discomforting. And washing of hands doesn't take anything much away from someone. So we'll still keep emphasizing on these precautionary measures as we go along.
And washing of hands properly too, because of course you need the soap and the water, and there's a particular
technique.
Technique to it.
And it has to be nothing less than 20 seconds. Otherwise, it's presumed you may not have done it properly.
Oh, okay. Yeah. What about those who have face shields? You know, that seem to be out there now for those who, you know, are using it without the face mask.
That is not appropriate. When we started church last weekend
in Lagos,
I had to go around because I'm part of the COVID-19 in the church. I had to go around meeting a few people because the way this face shield is taken, I know the face mask is not too convenient, but some people are making a mistake thinking that the face shield can cover. The face mask covers your nose and your mouth, and these are where the secretions come. The face shield covers the whole face and prevents splashes. But if you look at the way the face shield is designed, you have spaces. So it's like an addition to face mask. It's not either or, you know. So if you have the two, better. But if you must choose one, the face mask is preferable.
Because some people that, you know, because they wear the face shield and there's no mask, they tend to also drop, you know, this saliva or, you know, the droplets.
Yeah.
Whenever they talk.
Definitely. And that's why I said if you have to choose one, the face mask is more like it. So people, I see it like people trying to make a fashion statement at times because the protection is not really there without the face mask. So it's important we note this, that the face shield without the face mask is not, because if somebody gets infected and be like, but I've been using the face shield and all that, without the face mask, you've not really protected yourself.
And it may just be that you have touched a surface that someone who's got the virus, you know, had dropped the droplets and, you know, you by whatever means you find it on your face or in the eyes.
Exactly. You know, when you touch, you are told to avoid men, mouth, eyes, and your nose. So if you by any chance touch any surface that is contaminated and touch any of this, that's another source of infection.
And that's why hand washing is very important.
Exactly.
And so let's go into the issue of, you know, this active community transmission stage that we're in. Is Nigeria really empowered, you know, to take care of this at this time? Well,
like I would say, we can only try. The active phase of community transmission, everything still boils down on approach of individuals that are within this community. Yes, we're trying. Like, we're moving away from treatment of mild and asymptomatic cases in the isolation centers, and we're moving towards the community-based care. Lagos State Ministry of Health.
And that's the market there, you see. Several people, some wearing the mask on the chin.
And some, when they manage to cover the mouth, you find out that the nose is still open, you know. And so many, if you look at the percentage of the people that are not even wearing at all, is quite a huge number, almost like 70% or even more.
So this can be one of the factors that is driving the community transmission.
That is it. Okay. That's one of those things.
So you were talking about Nigeria handling this.
Yes. So with respect to Lagos State, in which I'm a part of, at least I know that we're moving away from treating asymptomatic and mild cases in the isolation centers. We're moving towards the community-based approach now. There are a lot of trainings going on for healthcare workers so that they will be able to do this within the ambit of good infection prevention and control. So we are making a lot of progress with respect to this. And I hope with that we'll be able to contain better in the community.
And that's what we're looking forward to. Of course, we have over 11,000 active cases currently, and we're hoping that it would drop more and we will not have cause to continue to record cases.
Our case management has been quite fantastic. At least in Nigeria, the death rate is lower than even the global one. Global one is 3.75 or something, while ours is less than 3%. So we've done a good job.
Okay, we hope so. Let's, Ayola, just before we go, let's take a call. Hello? Oh.
Hello?
Hello, thank you for joining us.
Yes, thank you. Hello,
please,
am I home?
Please go ahead. Yes, go ahead.
Yes, please, I just want to commend the doctor on your program.
Thank you.
Hello?
We can hear you.
He's doing a nice job. So my contribution would be if you can help us lay emphasis on it the more. That is the usage of face covering, that is the mask particularly. I've been observing the way people use it. So some people think it is not necessary to cover the nose. They think the people contract the COVID-19 more through breathing, not even through sneezing or whatever. You know, some people have come up, doctors, through research, that, it's spread more in the hair. How could it spread more in the hair?
Thank you so much, Ayola. And you can also be an ambassador, preach the message, take responsibility. And I'd like to thank you also, Doctor, for coming on the show today. Dr. Ime Okon is a public health physician and the Secretary of the Nigerian Medical Association, Lagos State Chapter. Thank you.
Thank you, Yomi.
Thank you. And that's the show for today. If you missed any part of Health Matters today, do log on to channelstv.com/podcast for the audio and the video versions. Thank you once more for joining us. I am Yomi Otaigbe.